Okay, we should be live.
All right. For those that are joining the call, welcome to the seminar today on wildfires in LA, smoke exposures, and your health. Just going to take a quick moment to allow people to join. I am Dr. Vanessa Carey, and I am delighted to join you today to this live discussion, which is hosted by the Department of Environmental Health at the Harvard Chan School of Public Health and in partnership with Seed Global Health Today. Today, we are bringing to you a number of experts from the community. From the Harvard School of Public Health, who really bring deep and long expertise in working in the space of climate and health. These include Joseph Allen, who's the director of the Healthy Buildings Program here, Mary Rice, the director of the Center for Climate and Health and Global Environment. We have Francesca Dominici, who's the director of the Harvard Data Science Initiative, Kari Nadeau, who is the chair of the Department of Environmental Health, and Ruta Nori Sarma, the Department of Environmental Health. And I am Vanessa Carey, a member of the Department of Environmental Health, the CEO of Seed Global Health, and the World Health Organization's Special Envoy for Climate Change and Health. Just some quick business. I want everyone please to take a moment to note that we really want to hear your questions as we go into the seminar today and to have an opportunity to hear from you the things that are most pressing, that are most concerning, and that you would really like answered. We will endeavor as a team to answer as many of the questions as we can today, but we want you to know that you will be able to continue to ask questions of us, and we'll kindly ask you to share your email if you've joined today, and to email Dr. Nadeau at knado@hsph.harvard.edu with your email to stay in touch for future newsletters and communications as we are learning information, as well as to ask any questions that we have today. So I welcome everybody to this call, and it's really a pleasure to have everyone here with us as we attempt to address what I know has been a really heartfelt, difficult, and shocking moment in the city and history in all of your lives. I come at this actually very personally. I have a huge amount of family and friends in the LA community, and part of the inspiration for trying to ask my colleagues at the Harvard School of Public Health to join today to answer these questions was knowing the number of questions that I've been asked from many to try to help create a pathway forward as the community recovers and knows how to protect itself, your children, yourselves in this both acute and long-term moment. We welcome your questions, obviously, to send us so we can answer anything. I'm gonna ask some questions that we know are pressing off the bat to our panelists today. We'll spend some time having our panelists answer those questions, and then we will also then move to a more live engagement, answering your direct questions in the second half of this session. And anything that we don't answer today, we will collect. We will continue to review, and we'll aim to send out answers and continue communication in a newsletter. So welcome and thank you. And I speak for a moment just to acknowledge that, what we're facing in Los Angeles is unfortunately a phenomenon that we're seeing increasingly around the world today in climate and health. The work that I do globally at Seed Global Health has very much underscored some of this in terms of where we're seeing communities hit in other places around the world. But it is never hit in the kind of scale and scope in an urban area in the way that I know has been felt for many right now, and that has been very shocking given the time of year and the full impact of what's happening and continues to happen. There are fires that are continuing to break out all the time. So I wanted to start by asking Dr. Nadeau to answer, please. Just to begin at the very basics, what are the primary health risks or concerns that are associated with wildfire smoke exposure? And equally, what are the research gaps for wildfire smoke exposures and health outcomes that we're going to seek to address in the coming weeks and years, or that need to be addressed as we look at these moments?
Thank you so much, Vanessa.
I
It's
might add,
wonderful
if
to
I
be
could,
here.
one more little piece that I think is very important that I've heard a lot. Also, if you could explain why an event like this is maybe different from like what we saw in 9/11 or elsewhere, because I know there's been a lot of trying to understand that as also.
Absolutely. So, first of all, we are so happy to be here to try to be of service to the LA community. I am wanting to make sure that we provide information on the health risks as well as the toxins that you could potentially be exposed to. And I come at this also as a person that has done a lot of work in LA, but also in the Bay Area, where I had to evacuate my own home 3 times, my family, my pets. So I just want to make sure you all know we here, even though we might be in different parts of the world, we very much empathize and sympathize with what you are going through, and we want to be here for you. The health risks should be taken seriously. And my colleagues, Mary Rice and Francesca Dominici, are here today to give you more details on those health risks, but they both fall within the acute setting as well as the chronic setting. You probably have done a lot of work already looking on the internet for what are the health risks. And so they can pertain to the lung, to the heart, they can pertain to mental health, very importantly, as well as to your function of your brain. And it depends on the type of age as well as the type of person, whether or not they're healthy or whether or not they have susceptibilities to diseases already. But importantly, anyone can have an effect of wildfire smoke on their health. So no one is safe from wildfire smoke, and we'll talk about that today. In addition, is it similar to 9/11? Not exactly. We're learning a lot, and here are where the research gaps are. We need to understand better as to the air and the soil and the water contamination that are specific to LA. LA had thousands of buildings go up in smoke. That's very different from 9/11. 9/11 had an intense amount of different type of building materials that all came down in one day, as well as an airplane that was very different from LA. So I don't want to say that anything is the same as LA because LA will be LA. And importantly, as we understand better, and the research gaps that currently exist are both on the acute level of each of your communities, what exactly you were exposed to and what you continue to be exposed to. And then finally, we'll also think about research gaps chronically. Many places around the world are exposed to wildfire smoke, but we don't know the effects after 5 years, after 10 years. And really, in the LA area, as well as other areas of the West and other areas of the East and other countries, it's not really a matter of whether there will be another wildfire. It's a matter of when and how we'll react to it. And so we want to get ahead of this. We want to be able to be responsible as researchers to your community, as people that are also part of the public to help you and your communities understand what these issues are. We want to hear back from you today what your questions are. But right now, we need to have those research areas done to best help you. But I would say that they are very different, and I wouldn't necessarily immediately assume that there are a lot of toxins that you need to worry about. Let everyone do the research first, and we're locking elbows with the Public Health Department in LA. We're locking elbows with others to be able to get you accurate facts before making assumptions and before changing plans.
Thanks, Kari. And I want to switch now to Francesca to kind of answer some of these acute questions because I think one of the things that is very real is that the acute event of wildfire smoke is obviously very concerning. And I guess the question the question I do want to ask you is, how does wildfire smoke compare to other types of air pollution that we might see on a more chronic level? What should we be concerned about smoke in our air? How does it impact air quality in the acute moment as well versus issues that might be more chronic? And as the wildfires move away or aren't as present on a active smoke level, do the risks diminish in real time? And are there, what are the considerations in that situation, if that makes sense?
Yeah, thank you, Vanessa. I'll try to just provide some facts. So first of all, in presence of wildfires, the most common pollutants that we are exposed to is fine particulate matter, PM2.5. And we know a lot about both the short-term and the long-term impact of fine particulate matter. It's a pollutant that is regulated by the Environmental Protection Agency, and as my colleague Harry mentioned, has a short-term impact on the cardiovascular, respiratory, and cognitive system, and also long-term impact. The second fact is to get a sense of how dangerous the level have been for PM2.5 is the current National Ambient Air Quality Standard for daily exposure, so the safe level of exposure to fine particulate matter on a daily level is 35 microgram per cubic meter, and at the annual level is 9 microgram per cubic meter. On January 8, in the area, the level of fine particulate matter were close to 500 microgram per cubic meter. There is some work of the Berkeley lab to just get a sense of how high it was. They approximate that is equivalent to smoking 22 cigarettes that day. So just to give
in the moment of the fire.
yes, that particular day, right? Now, the other thing that we know is that when PM2.5 is caused specifically by wildfires, it's more toxic than PM2.5 caused by other things like construction or from fossil fuels emissions. And the reason is because you will understand that in this specific example, even more, the wildfires, because happen in the community, everything was burning, right? Cars were burning, building was burning. So they not only the level were extremely high, but the toxicity was also high. In terms of the long-term effect, we know a lot about the chronic effect of fine particulate matter. We know a little less of the chronic effect of fine particulate matter from wildfires, from being exposed multiple times to this very high level. But you will understand that if we can conclude that long-term exposure to low-level, less toxic PM2.5 has an adverse health effect on mental health and cardiovascular and respiratory, we would anticipate, unfortunately, that a repeated exposure to high and more toxic level of PM2.5 will also have an adverse health impact on the health system. The last point I just want to make is to just keep this in mind that even if there is a day where the levels are very high, the risk doesn't go down the following day as the level declines. They will tend to remain because we do know that inhalation of exposure fine particulate matter initiate a system and a cascade of inflammation that then stays with you and can cause adverse health impact. I'll stop here and because I'm sure many of my colleagues have a lot to add.
Well, I'm going to go to Mary next, actually, to follow up on some of the things that you just identified, which is what are some of the ways that people can protect themselves from being exposed to wildfire smoke outside of their home while wildfires are actively happening? Do you need a mask? When should I mask? So if the wildfires have moved away and the air quality monitors are saying that the air quality is better and there's not a lot of particulate matter, do you need a mask, for example, very pragmatically in that setting? And what are to that effect too, what are the most reliable measures of air pollution and air quality? That is a question I've heard consistently, which is, can I trust the government's reading of particulate matter in the moment? What are other toxins I need to be worrying about? So for example, houses burned. Volatile compounds obviously were released when houses burn, but those are volatile. They disappear after the fire is abated. But how do we think of these risks, both in the acute setting of a fire and kind of in the post? How do individuals protect themselves, and what kind of masks are needed and when?
Thanks, Vanessa. Such an important question. So we know even from exposing healthy animals acutely to this mixture of smoke that there's an immediate and intense inflammatory reaction in the lungs. And that is very likely what healthy people are experiencing when they are coughing, they have phlegm production, when breathing in this mixture of smoke, which is, as you said, particles, gases, VOCs, and we also know that it varies depending on what that mixture varies depending on what's burning. The simple answer to your question about should I wear a mask, I would say wear an N95 respirator. Technically, that is not a mask. So a mask refers to, say, a surgical mask or a cloth mask in front of the face. But when you breathe in, the air is just going to follow the path of least resistance, right? So if you're wearing something like that, you're still going to be breathing the smoke. So what's different about an N95 is it makes a seal around the face and it then filters particles. So it will dramatically reduce exposure to fine particulate matter. That's a mixture of carbonaceous particles, metals that are in the air from the burning. What these respirators do not filter are gases. And so that is a big concern about wildfire smoke is it's a whole mixture of stuff. It's not just the particles, it's the gases and the VOCs as well acutely. So keeping that in mind, that N95s don't filter out all pollutants, they're still a really effective intervention for that acute exposure. So your second question, I think, was about what information can we follow to know how bad the air quality is. And Francesca gave that comparison of the air quality standard is 9 right now. That corresponds to, when you look at the air quality index, an AQI that's less than 100 or even better, less than 50. So the air quality index is reporting what the EPA is measuring. And those are criteria air pollutants that are regulated, fine particulate matter, ozone, nitrogen dioxide, carbon monoxide. So it's not everything. Those are dependable measurements. So it is a good indicator of what the fine particulate matter level is. If you see a color that is green for your area and it's the AQI is then less than 50, I wouldn't say you need to wear those N95s, right? But even yellow, which is technically not so bad, probably a risk for susceptible individuals. Even for that level, I would wear an N95 in the setting of those smoke conditions to be conservative, because we know that that air quality index isn't capturing everything that's in the air. So there's a lot of question marks, but it's a reliable piece of information. I would look at that to guide whether or not to wear that N95. Now,
Is it fair to say, Mary, that particulate matter measurements are probably indicative of other things that are in the air? So if that measurement is green, people can feel reassured that other things are probably not circulating also?
I think as a rule of thumb, yes, but it's not perfect, right? And another imperfection of this measurement is that it's what's measured at a certain place by a monitor, right? And so it's not capturing, for example, the dust that gets kicked up from the ash that's on the ground, depending on someone's setting where they live, right? It's not measuring all those other gases that are in the air. Generally, they correlate, and I think other panelists, Joe Allen, can say more to this as well. Generally, it's a good indicator, but it's not perfect.
I'm going to come back to this question because I do want to pick it apart a little bit, but I do want to actually have a moment for Amruta to speak, please, to who is most vulnerable to wildfire smoke, just as we think about protecting our own families and who may be more at risk of having some of these triggers from the ozone or the nitrogen dioxide or the other bronchial inflammation versus how this might go across the epidemiology of a community and which communities may be at risk. So if you could speak to that and sort of ways that particular communities might want to be careful.
Yeah, that's a really important question. And one of the things that we can generally say is that when there's a wildfire event and when these air pollution levels reach the levels of particulate matter that Francesca was describing earlier, everyone is at risk. Air pollution exposure at that level is just unhealthy across the board. But Vanessa, as you're highlighting in your question, there are some folks that we're particularly concerned about. There are in particular, we might look at people with existing chronic health conditions where they might experience some exacerbations as a result of this air pollution exposure that they're experiencing during a wildfire episode. So, for example, people with underlying cardiovascular disease would be of particular concern, people with respiratory illnesses, people with other types of health conditions. Additionally, we're worried about the elderly, and we might be also particularly concerned about young children. In the case of children, I think one of the reasons why we're concerned is because children tend to spend more time outdoors. They tend to have higher rates of respiration because they're very active and they're, running around, playing, enjoying the environment. And so this is obviously in general a very good thing for development, for healthy development among children. But during these extreme air pollution episodes, this might also lead to adverse health outcomes for children. Another population that we're particularly concerned about is pregnant women. This can be an issue for people during pregnancy, during the postpartum period. It can also be a particular concern for neonates and for infants in terms of respiratory outcomes, in terms of other types of systemic inflammation that Mary was mentioning earlier. And so these are some of the populations that we want to make sure we're particularly effectively communicating with about some of the risks of air pollution exposure.
Can I ask you a little bit to speak to how can those particular populations, what are the precautions maybe they should take, especially for children, infants that can't wear, these N95s as easily, or, and how do we protect them? Indoor air, what are, purifiers, what are the tools that might be available? And I would actually open that up to anyone else who might want to answer in addition, if someone wants to speak to that. And then Joe, I have a question for you in a moment too. Or maybe Joe, actually, I'll send this one to you if I can. Amruta, thank you. And Joe, if you could maybe, we can certainly return to that question, but I would like you to actually speak to something that I know there's been a lot of questions on, which is there's a big push right now in the community to return home or to go to homes where the homes have not burned or there's an option, or how to get back to quote unquote normal despite this devastating event that has happened. And what should families returning to homes that are still standing be concerned about? How homes not burned, how have they been impacted by the recent fires? What can people do to protect themselves in their homes? And then what I'll do actually is return to the question of how do vulnerable populations protect themselves. So that is not a lost question at all. I'm just going to defer it for a moment when we come into answering some of the questions we've gotten from the panel. But Joe, I'd love to hear from you, please, to those pieces and considerations.
Yeah, thanks, Vanessa. And it's a real privilege to be here with you and our other colleagues in service of those in LA. I have family and friends and colleagues there and just want to be helpful in any way that we can. I think one of the things we have to recognize is that these outdoor pollutants penetrate inside our homes, offices, and schools. And then knowing that, there's a couple things we can do to lower the risk and be safe inside. And so I'll give you 3 tips that I've been giving out to friends, family, and posting on social media. The first is you want to filter the air. So if you have a central air conditioning system or HVAC system, you want to upgrade to what's called a MERV 13 filter or higher. In addition, you can use one of these portable air cleaners or portable air purifiers. Look for one that has a HEPA filter, and you size it right for the room, and those can be very effective. And we have a tool on the Harvard Healthy Buildings website to help you size it if you're not quite sure. Third thing related to filter the air is you want to, if you're in a home that's near the burn area, you can get a portable air cleaner that has both a HEPA filter to capture those particles and what's called activated carbon, which captures those gases. So you can look for one of these combination portable air cleaners with HEPA plus activated carbon. That's for particles and gases. And if you're going back into one of these homes, especially if you're doing some cleaning, you want to look for one of these respirators. And I'd recommend one of those respirators that has the double cartridges. Look for something that has a P100 plus multi-gas. Again, that'll capture both particles and the gases. Second big thing to do is control the dust. So that means kicking off your shoes when you come in the house. You're not tracking in any of that settled soot or ash that's outside. If you're going to clean surfaces, recommend a damp wipe. So you're not just resuspending that dust, you're actually collecting it. And the third thing related to controlling dust is use a vacuum cleaner and try to look for one that has a HEPA filter and is really air sealed. So some vacuums will just collect the big stuff off the ground and kind of redisperse small particles. So look for a vacuum that has a HEPA filter that's air sealed. Third big thing you want to do is monitor indoor air quality. So as Mary said, the regional air monitors are good, but they're not going to tell you what's actually happening in your home. You can look for one of these low-cost air quality monitors. You can get them online anywhere. And make sure it has 2 things. You want to be sure it's measuring PM 2.5, as Francesca talked about. That's essentially airborne particle levels. And it should also measure what's called TVOCs, or total volatile organic compounds. And that's measuring airborne gases. So if you do those things, filter the air, control the dust, and you measure what's happening in your home, you can certainly reduce exposure, keep people safe, and also know what's happening in your immediate environment, regardless of what's happening outside or around you.
Joe, could I ask you also to comment on water quality? Because that, I think, is a question that we've received in the chat. And how can we monitor the quality of water or to know the safety of the water and its use?
Yes, those are really good questions. First, I'd say pay attention to local advisories. You see some boil water advisories out there, and they're letting people know in certain communities when the water is safe to drink. So the government is monitoring the local water quality. It's a little bit harder as an individual to measure these water samples. You could take samples and send it off to a lab. If you're concerned, there are filters that you can use that'll capture some of the microbes that might be there, or some of these heavy metals we're talking about. So again, you can find these filters online. They're relatively affordable, but I'd pay attention mostly to what the local government is saying in terms of the boil water notices and when it's safe. They'll be monitoring for things like some of these chemicals and any microbial contamination. But there are filters you can buy for under the sink or right at the tap that are pretty effective.
That's great. One more question for you about environmental and sort of contaminants issues. Playgrounds and soil is a really big concern, I know, for a lot of the parents and folks and that we know. So can you speak to knowing the safety of that, or how we can identify, there's a lot of schools that are open that are very proximal, for example, to these fires, but maybe just outside. How do we know that those are safe, or for those houses that didn't burn down but are in the middle of this? How can you monitor or ensure that safety, or what does one do?
Yeah, ideally, and this should be happening, especially for schools or homes or offices or any parks that are kind of near the burn area in particular, the soil testing should be taking place. So we know where the contaminated soil is. And then, as we saw in Maui, we did some work on Maui, there's soil remediation or cleanup. In the absence of that information, so people want to know, what can I do right now? I think it's really important to do things like basic hand washing. So if you're outside, your kid's outside playing, you just want to get that dirt off. And again, make sure they're not tracking it into the homes or schools. So there are things like walk-off mats that can pull off some of this dust as it comes in. So again, it's about controlling that dust. And in the interim, without any data, some basic hand washing, keeping those shoes and dirt from coming in, and also controlling that dust after the fact. So vacuum again with the HEPA filter and some of the damp surface wiping will go a long way, even if the soil has some residual metals or contamination.
Thank you. And, Joe, I know you touched on this a little bit about how we can monitor toxins which aren't, or this was discussed by some of you about how we can monitor toxins which aren't included in AQI or shown by weather websites. Kari, do you want to speak a little more to that as well? And sort of what are other reliable sources of current health information that folks can turn to in the coming months?
Absolutely. This is really important because, as many people have seen in your own air as well as in your own neighborhoods, this was not just a wildfire. It's not just wild. You also had commercial buildings, residential buildings, cars going up in smoke, your favorite upholstery, or not, or you're going back to your home. So we want to be super careful. And as Mary Rice had mentioned, there are certain things that we can measure and monitor and manage. And the government does that and does it with the resources that it has. But those collection sites are only in certain areas of LA. They're not in every neighborhood. In addition, they only measure what they're regulated to do by Congress and by federal agencies. So with that, there are chemicals that we need to understand more, and that requires research, but we have the tools to do that. And that's really important for the community in LA to know, that we want to help, that we want to lock elbows with your public health department, with other universities there, to be able to track these different toxins that are important to monitor, that do affect health, both acutely as well as chronically, and that those will be very helpful as we think about how to best communicate that back to you, what those toxins are in the soil, in the air, and in the water. And we'll be working hopefully with local communities to be able to get that information to you in real time with the detailed locations that communities need that might not necessarily be picked up by the EPA monitors. In addition, we need to also monitor health outcomes. So we're working with your local institutions and local public health department, as well as our data science group here, thanks to Dr. Dominici and others, and with Amruta Nori Sarma, to be able to really collect data in real time with the health outcomes on the population side of LA, but also in the individual side. So we'll try to communicate this all to you in real time because we want to be able to help you manage this information. Thank you.
Thanks, Kari. We're now, I'd love to sort of open this. We really welcome your questions for everyone who is following live and to continue to ask questions. We want to be able to really engage with all of you to answer the things that are big or small that are pressing and on your minds or that you're concerned about. And then I have some other questions for all of you on the panel to also help answer. But we did just get one question in that says, if you don't live in the burn zone and you don't smell smoke or see ash and the PM 2.5 level is moderate, which I presume is meant to be, I don't know if that's meant to be the yellow or the green level, but can you go outside knowing that the current AQI measurements do not account for the specifics of a wildfire? So I think people are really trying to determine sort of what is the, you've got small children, you're living in Los Angeles, you've got the Hughes fire up north, you've got semi-contained fires elsewhere, but you're getting a green AQI for your general area. Kind of what are the safe rules of engagement now and sort of for the future or the considerations? And so I don't know, Mary, I'm going to put you on the spot for that one if you'd like.
Sure, yeah. As I said before, I would err on the side of caution. Moderate yellow AQI in this setting where there's multiple fires happening, I would recommend wearing that N95 while outside, especially for people who have a chronic lung disease. So asthma is one of the most susceptible groups when we're looking at health conditions. And that's because people who have asthma have airways that are already inflamed. They respond in an exaggerated way to toxins, inhaled toxins. And so when we look at the evidence on health effects, it is just overwhelming that wildfire smoke is bad for asthma. And per unit mass, as Francesca was pointing out, is worse for asthma than other kinds of PM, which are also unhealthy, on the order of magnitude of 3 to 10 times as bad. Looking at whether you measure it, looking at the inflammatory response in the animals, the hospitalizations among young and old people, use of albuterol rescue inhalers. So for that reason, for people with asthma, I would say be cautious. You might look silly with an N95, but I would recommend it in this acute setting. People with chronic lung disease like COPD, same thing. People with chronic heart disease and kidney disease, as well as a susceptible subgroup.
Could you
You
also
have a follow-up
I was
question.
going to ask, and then I'm going to go to Francesca also for some
Yeah.
comments. Could you also comment on how heat can play a role in exacerbating or not exacerbating some of these issues? Just recognizing that it can get, even this time of year, there's variation in the temperature in Los Angeles.
Well, there is evidence that heat can exacerbate lung disease and interact with pollution to make it worse. To be truthful, I think right now I'd be more worried about the air pollution than the heat with this climate right now, this time of year.
Very fair.
Right in the summertime, I mean, this is another unique situation, right? This is unprecedented to have wildfires of this magnitude outside of the wildfire season, right?
Thank you. Francesca, can I ask you to comment and then I'll go to Joe with another question.
Yes, very briefly, I wanted to point it out that unfortunately, the other thing that we know that the exposure to PM 2.5 from wildfires can travel pretty far. So we always need to remember that there are not only the area that are in proximity of the wildfires that are at risk. I want to remind a few months ago when we had the wildfires, I believe it was in Canada, where we had an orange sky back in New York City. So I think this is unfortunately speaks also to what Kari was saying in terms of additional research, because we will need to track how far it's going and what are the areas that are exposed above and beyond the obvious one.
Thank you. I'm gonna deflect this question to Joe, this next one that we have, which has asked the question of sort of looking at the Healthy Materials Lab and talking about how many homes and businesses were constructed primarily with materials on the red list and being able to really answer that question. So Joe, I know you've been doing a lot of work on that, and I might ask you to also weigh in on a second question we got that was specific to the fact that a school is adjacent to a burn zone and had ashes in the locker, and sort of do the books have to get thrown out, and what is the level of managing that kind of exposure?
Yeah, so two really good questions there. And let me address the red list. If you're not familiar with the red list, this is a list of well-known toxic chemicals that people are trying to avoid nowadays in the materials we use in our homes and schools, like chairs and carpets. And building on what Kari and Francesca were talking about, an urban wildfire is really quite different, especially with homes of this vintage. So you're going to find a lot of these chemicals that are on the red list. So they've been banned, but they're in commerce. They're in the products in many of our homes and schools all over the country and all over the world, for that matter. And that's things like lead, which we're actually seeing offsite. And to Francesca's point, many, many miles away from the burn site, we're seeing elevated lead. There are chemicals like PCBs, which were banned in the 70s, that we can still find in buildings. There's things like asbestos and asbestos fibers that are used in older buildings, banned in the 70s, but still around in many buildings. And that's all the kind of the mix that's getting released. There's also the concern about chemicals like the PFAS chemicals, or maybe you're familiar with them as forever chemicals. So these are chemicals that persist in the environment for a long time. They're quite toxic. And very little, if anything, is really known about the forever chemicals and urban wildfires. And this is one of the things we really want to study as these kind of chemicals on the red list get mobilized, both through the air and surface water, into the community. What levels are we seeing? Where are we seeing them? Are they a level of concern, and what to do about it? Still, I point back to my tips. I think with a lot of these unknowns, a lot of these strategies I've recommended how to keep safe in homes and schools still apply. Again, you still want to filter the air. That's going to capture things like asbestos fibers and lead particles. You want to clean those surfaces or keep them clean, and you can monitor the air.
So for the very specific question of throwing, the question about books being exposed to ashes and lockers and things like that, would you replace those books and just remove that exposure? And then I'm going to ask another series of questions of the full panel that are somewhat related, but how could you guide that parent in that case?
Yeah, in homes and schools that are particularly close and impacted, where you're seeing ash and dust, you're going to see some lingering issues. So even after you clean up that visible soot or ash or settled dust, a lot of this can absorb into porous materials like books or carpets or chairs. For people who are a little bit further away, you can open up your windows if the air quality is good and you're trying to drive off anything that's absorbed. Some of these volatile organic compounds, which are gases, actually can also exist in particulate phase. So that's a little technical. All that to say is that you can even have some off-gassing of some of these VOCs. In fact, if you walk into a home or school and you smell that something related to the fires, that's probably the VOCs you're smelling as it's kind of off-gassing from these particles. So I think if you're really close and your home or school was hit pretty hard with this, a lot of the porous materials probably going to need to be discarded. It'll depend on the location, the extent of the impact, but there are firms that actually can evaluate this, that do this kind of fire cleanup, for example, in a home, that can give specific guidance that really depends on your condition. But yeah, these porous materials are definitely going to absorb and then off-gas over time in the coming weeks and even months.
Thank you. I really appreciate that. We've had a number of questions that have touched on very similar themes. So I'm going to kind of attempt to summarize it, and then I might turn to you, Kari, to kind of open, but would ask all of our panelists to weigh in on this. But there's a series of questions that really relate to being adjacent to the burn area and the fact that remediation is going to be ongoing and long, cleaning impact is going to take time. And so what is the safety and immediate area for children, especially for schools that are managing kids? What are the immediate things maybe schools need to do to remediate the very most urgent risks? What are the things that are just going to take longer? A lot of questions about whether people who are growing fruit or vegetables or have access to gardens, do they need to remediate their soil and replace the top 12 inches? And then I think there's actually desire for definition of just what is proximity, right? And what are the layers of concentric circles for this is the urgent thing for within a half mile. This is kind of the 1 mile mark. And if we could do some delineating there, that would be incredibly helpful. And sort of trying to understand, again, I think reviewing the safety of exposure after the wildfire to ash, to all these other things. How long does it take for that off-gassing process to happen in these homes. And I would also, and again, just for our audience to note, we will try to summarize a lot of this into a fact sheet after the fact to share with all of you, so that if it doesn't absorb now, it will be available in the future, and we'll list the air purifiers and some of the quick tips that we can do to keep you and your families safe, you know, and to answer some of these questions on a continual basis. But if we could just if I could ask Kari for you to start, and then the panel to really comment.
Yeah.
What is proximity, and within certain realms of proximity, what are really the acute things that need to be done versus the longer term things, and and again, really focusing on the safety, health, and well-being.
Absolutely. These questions that you're all asking are excellent. And we as panelists only can answer what we know. And what you're seeing is that we will answer as much as possible based on data, based on research, but we're only as good as our research. And we're only able to do a lot of these things and have a panel because of other people that have dealt with wildfires. And we've been able to study those communities, and other people have studied those communities. So if we can't answer a question today, it's because we might not know the answer, but that we will make sure that your questions then inspire us to do better research and find the answers. So I just want to make sure everyone knows that. And there are excellent questions that you're all asking in terms of proximity and other aspects of wildfire smoke exposures, both on the ground, in the air, in the water. But importantly is that we can measure what we can measure. And then typically in public health and the work that we do in environmental health, we measure, we monitor, and we manage. And so within those themes, what we're dealing with here is questions about proximity. We cannot assume, like Francesca mentioned, that just because you're hundreds of miles away, if you were in a boat in the Pacific Ocean and the fires from the Palisades were actually blowing, unfortunately, westerly, then that boat could have been exposed to wildfire smoke, even hundreds of miles away. And that boat did not necessarily have an exposure unit on it. So you have to assume that if you see it in the air, that if you see the orange skies, that that's not good, and smoke crosses boundaries. And so if you're looking at a specific mile or 2 miles, that's going to be different. We need to measure it in your community to know exactly if you're safe or not. And so the air quality index is very helpful. Air Now is very helpful. CAL FIRE is helpful. But as you all saw with LA, your winds were going 100 miles an hour. And so because of that, the communities that were affected, it was basically changing on an hourly basis. You probably go to Air Now and look at the last monitoring and it was green, but you in your home would actually be seeing completely skies full of smoke. And so because monitoring by the EPA can only occur at a certain time frequency, those winds that you were affected by also affected your exposures. And so that's a major research gap that we need to be able to monitor more frequently and monitor in more details. And that takes resources and time and researchers, and we're going to be able to do that. So to answer your question, the important thing is that wildfire smoke is harmful to your health. It harms even healthy people. It harms all ages, potentially. Repeat exposures chronically need to be monitored. We're really excited to be able to work with your groups to think about that. But that at this time, like you're hearing from my colleague Mary Rice and others, be cautious. Be conservative. Don't assume that something is clean. Ask your local agencies to monitor and measure the turf in your school. For those public agencies that you can have access to the water and be able to measure whether or not it's contaminated, ask your public agencies to do that. That is their job. And obviously they're overwhelmed right now. So please obviously take care as you ask your local governments as well as your local businesses to try to do this. But I think it is important to, again, measure and then monitor and then manage appropriately with data and with informed science.
Francesca, could I turn to you to maybe elaborate a little bit more as well?
Yeah, super quick to also point out an important gap of research that we are committed and dedicated to address. So we talk about a lot of things that we know. One thing that we know less is whether in the context of wildfire smoke exposure, it's worse for your health to be exposed for a few days to very, very high level versus, as Kari mentioned, to be exposed for over a year on your boat outside the Pacific. So in that context, we don't know what is the trajectory of exposure to wildfires that can be more harmful to human health. And so that is really an area of research that we are committed to investigate more.
And I think what both of you have highlighted is that part of the frustration here is there are just unknowns that we cannot solve at this time, but that there is commitment, wherewithal, and expertise to solve, and that are going to need to be solved in this evolving world that we live in, where wildfires are going to be more frequent around the globe, in addition, obviously, to this community. I think that I want to also highlight the fact that the need for the monitoring is really important, and the ability to be very active and proactive to understand what the risks are is probably one of the safest ways to protect ourselves, and drawing on the resources of obviously the public health agencies that are there to support, and the other public agencies that mandate, but drawing on the community within LA and the academic community, and obviously, communities like ours that are committed to also answering these questions and creating safe pathways for folks. And I think that will go a long way to protecting. I want to turn to another question that was, I think, a series of excellent questions from Paul, who is supporting school community there. The questions very specifically, are there VOCs still in the air at dangerous levels? And it makes a very astute point that in Los Angeles, a very car-driven community, the yellow AQI is a standard for LA. So does this mean an N95 is needed 200 days of the year, given that is the frequency of seeing the yellow AQI in that community? And I think that's a valid question. And then also very good question about being concerned as remediation goes on and the cleaning process starts. How might the AQI change as things are getting stirred up? That's been a theme in community conversations, and people are moving away in droves, and that can impact the community, the school community, others. And so is that a concern about, to be considered? And so don't know who wants to take a stab at that, or I'm happy to assign. Mary?
Yes, I'm happy to discuss Paul's very good question about the N95s and chronic exposure to air pollution. So
I might ask you to tuck in one other thing, which is the difference between a K90 N95 and an N95, which also came up, which I think is very helpful and is a question that we know we saw in COVID too many times.
Oh, okay. I might actually turn to Joe for that technical question.
We'll go to Joe on that one, but if you start with the first one and then Joe,
give a better answer than me. But so that is a very good question that Paul asked, because we know from decades of research on fine particulate matter that no amount of fine particulate matter is good for health, right? So lower levels of exposure are always better for health. The data has shown that consistently. However, wearing an N95 or a K99, that's uncomfortable, right? And there's a psychological toll to that. I come across this as a pulmonary doctor when I think about when to put somebody on oxygen. Sure, there may be benefits to the oxygen itself, but does a person really want to be wearing that oxygen all the time? And so those factors are really important. I don't want to dismiss that. And so what I said about the yellow AQI, which is what I'm saying about wearing an N95 in that setting, is about this acute exposure around this wildfire event. I'm not recommending that everyone wear an N95 every day when they're outside for air quality that's in the moderate zone. And I'm basing this really on the balance of all the all the factors that go into decisions that we make about health. For the N95s in this acute setting, I'm really talking specifically about high-risk adults who have chronic illnesses and asthma in particular. And there's another important factor here, which is that there are not N95s approved for kids. But what Paul has asked is a very important question. And I think, truthfully, there are no very clear public health recommendations. This is another research gap. We've talked a lot about research gaps on exposure assessment and estimating health risks, but there's an equally important area of research around behavioral science, what recommendations make sense, what public health recommendations are likely to even be followed, realistically. And that's a very important line of research as well, that I'd like to highlight. And I might ask our team to include a workshop report that highlighted some of these issues specifically, that I'm happy to share.
Thank you, Mary. Joe, I'm going to have you please tackle the KN95 and 95 question if I can.
Yeah, sure. So understandably, there's still lots of confusion about masks versus
And one other I'm
respirators.
going to throw at you that I just saw as well. Does turf need to be replaced? Sorry, go ahead.
Oh, all good. Yeah. So there's lots of, we've heard N95 talked about today, KN95s. I mentioned a P100 before. So let me try to clean this up and clear it up because it can be confusing. So the gold standard out there is an N95, and the N95 stands for about 95% efficient at capturing particles. Those are really great. KN95 is an equivalent, but it's an international standard. The N95 in the US is the gold standard. KN95s can work. There was concern about some counterfeit KN95s from China early in COVID, but I think that's been cleaned up for the most part. I like an N95. You can also use a KF94 out of South Korea. That's what I was wearing during COVID. The other part of this, there are higher grade masks, and technically these are respirators. So I mentioned a P100. So you probably caught that the P is different than the N, and the 100 is different than the 95. A P100, the 100 gets you to about 99.97%, more like a HEPA filter. So it's a higher grade filter. The P designation versus the N simply means that it's still going to function even if you encounter an oily atmosphere, which you might actually encounter if you're cleaning a home that's been highly impacted or school. So this is why I like the P100 even better than the N95. The thing I would recommend if you're in one of these areas and actually doing some cleaning, and I mentioned it earlier, is a P100 plus multi-gas. So again, that looks like something you might be familiar with. A respirator has 2 cartridges on the side. Look for one that has P100 plus multi-gas. The P100 captures those particles, and the multi-gas captures some of those gases. Important last thing on respirators and masks is the 2 Fs. So we're talking about one, filtration. The other one is fit. Make sure it fits snug around your face. And technically, if you're wearing a respirator, you're supposed to be medically cleared. So I'll leave it to the physicians on the call here to weigh in on this. But you have to be careful for those with respiratory conditions. We use these in worker health and safety all the time, but people are wearing respirators all the time. Even an N95 or one of these P100s have to be medically cleared.
I'm going to ask you from a personal note, just because I think this question has come up from a couple schools and communities. I'm wondering what's with it. Do you mind commenting on like turf and turf's ability to absorb ash and all these things? And does turf need to be replaced as a remediation if this is the playgrounds and the communities that children are playing on? Which goes to the larger kind of continued questions about children's safety, which Kari, I'll turn to you next. Joe, I don't know if someone wants to tackle that.
Oh, sure. I wasn't sure that was for you. Yeah.
That one's for you, Joe, and then I'm going to go to Kari with another question, and then I want Amruta to speak as well.
Yeah, I think any of these outside surfaces are going to be affected similarly in the sense that you're going to have settled soot ash, and that's going to include any of the metals or chemicals we're talking about. And so again, I'd put this in the bin of a gap, and just like you test the soil, you can test these surfaces. You might have some absorption that might be different from soil. Soils are going to absorb too, but I'd put it in the same boat that we talked about earlier with the soil testing of these surfaces. This is not expensive testing. It's not very hard. And in the interim, while you're waiting for that information, you can take these precautions again, making sure the kids are washing their hands after they're outside playing on soil or turf or anywhere for that matter. And being sure, just like soil, turf, we can also track in. Anybody who has kids, my kids play soccer on turf fields, they're tracking in all those little rubberized pellets all the time from turf fields. So make sure we're not tracking in whatever's outside. Just don't track it into the school or home. There's some simple steps you can take there.
Thank you. Kari, do you want to comment on some of the many questions that we're continuing to see?
Absolutely. And by the way, I know we only have about 2 more minutes. So importantly, please email me your email. Email us your questions via my email. We will take them all down. We will be putting a newsletter together to be able to give you facts, to be able to give you materials, to be able to give you information as to when you go back to your homes and what to worry about in your neighborhoods and your schools. Again, we know what we know and we don't know what we don't know. So like Vanessa said, we are going to help as much as we can for your community to be able to try to answer those questions. So the newsletter is one item. The Wildfire Commission for the U.S. government just met. We also are caring about children and pregnant women and laborers out in the fields wearing N95 masks. As you heard, it's very difficult for some people as they're working as well as children. Children will undergo a lot of stress and psychological stress, as well as all of us, in terms of the mental health issues that come up with displacement and seeing your house burn and seeing animals, for example, be lost. So those things we really care about, both on the acute and chronic levels, and especially for children. So we'll also send resources that have been used by other communities for children. And then finally, we are going to lock elbows with you and follow not just the acute issues, but also long term. And we're very grateful for an amazing community in LA to potentially help us do this for a longer period of years. So I just want to give you that hope and promise that we are here for you. And I'm so grateful to my other panelists here and for Vanessa for moderating. But again, email me and we'll put you on our newsletter and we'll answer some of these questions that we weren't able to answer today. Over to you, Vanessa.
Thanks, Kari. I want to give also Joe or Amrita, Francesca, and Mary an opportunity to make any closing thoughts or statements before we'll close and share what next steps are coming. If anyone wants to. Amrita, do you want to speak? Do you want to share?
Sure. I just wanted to say that, as a scientific community, we're really aware of the fact that these wildfire events, as Mary said, this kind of situation occurring at this season, at this time of year is really unprecedented. And this is something that, we think in the long term is going to happen more frequently, more intensely across broader parts of the United States. And so we really understand the importance of these gaps that have been highlighted by my colleagues across the panel. We're really dedicated to trying to address some of these research gaps and also working with different communities to make sure that they have the information that they need in order to be able to make these really, really critical decisions for the health of themselves, for the health of their families. And so I think we just want to highlight that, this is a huge commitment for us over the coming weeks, months, and years.
Thank you.
Express my sympathy for the many people of LA who have been affected by these terrible fires. And I recognize how many of you have been scrambling for good information and how difficult it's been and how distressful this must be for your families. And thank you for participating in this webinar. And I look forward to engaging in research together with collaborators in the LA region and to answering any questions that come up after this webinar. Thank you.
Thank you. And I'm really grateful to all of you as panelists for assembling really quickly to help engage in these pressing questions. And I think I want to echo and second what Mary said about just really having, our deepest heart, souls, and minds accompanying and in solidarity for what's happening in Los Angeles. And all of us have connections to the community in one form or another. And I think that what you are living through is an unfortunate reality that we're going to face globally, which is that we are seeing increasing events that are affecting our health every day. And the climate crisis is a health crisis. And that is the lived experience of climate change. And unfortunately, your community is on the front line of telling that story. But that's also a very powerful opportunity to create the change we need, even in this moment that we're living in right now, which is rapidly evolving of different conversations, different political sways. But there are still facts and there is still truth and there is still evidence. And that is what our community at the school and in the Department of Environmental Health is very, very committed to telling that story in an evidence-based and research-driven way to get to the answers quickly. And so for next steps, we really encourage you to be in touch if this was helpful, if there's a specific area that we can deep dive into or do this again with all of you. We are committed to doing that. We want to get back to you with newsletters. We don't want this to be a one and done. Kari and others will be in the community and next month as well. And so if there's an opportunity in person that we can be engaged in a way, we want to be an added resource. The community is overwhelmed And while everyone is doing as much as they possibly can, we're here also to help support in any way that we possibly can do. And we know we didn't get to all of your questions today. We will endeavor to follow up very quickly with a newsletter responding, and we would encourage you to be in touch and to continue to ask questions. We want to really be able to protect the health and well-being of you and your families in what is a not only physically traumatizing moment, but emotionally and psychologically. So thank you for joining us today and for being a part of this. And we're deeply committed to being as support as we can. Thank you.